Friends, my name is Dr. Priyanka. Today I am going to describe a gross specimen of uterus and cervix, that is without bilateral adnexa. As you can see, there is no attachment of fallopian tube and ovary behind the uterus. So on cut opening the uterus, you will see a well marginated, well circumscribed tumor which is predominantly solid, involving the body and fundus part of the uterus. You can see the endocervical length which is increased in size. So the tumor is basically well circumscribed with walled architecture with solid areas. You can see grossly there are no areas of hemorrhage and necrosis grossly in this specimen. So the most likely the diagnosis is leiomyoma. Now the second question comes that will be asked to you is, what are the differential diagnosis of this tumor? So you have to describe the differential diagnosis. It's a leiomyoma, so the most likely differential diagnosis is leiomyosarcoma. But in this you cannot say it's a leiomyosarcoma because the tumor is well circumscribed, it is not infiltrating the myometrium, and it is not showing the areas of hemorrhage as well as necrosis. So it's a benign tumor, it's basically leiomyoma. The question asked will be, what are the differential diagnosis? You have to say about the leiomyosarcoma. The next question which the examiner can ask is what is the difference between benign tumor and malignant tumors. That will be given in your neoplasia chapter, well defined with the tabulated form. You have to say those points also. The next specimen that I will be showing to you is this specimen. This is showing this cut open specimen of uterus with multiple fibroids. You can see the fibroid position is different. Some are subserosal, some are intramural, some are intramural. So you have to describe the this fibroid, and grossly you will see you can appreciate their areas of blackish areas are there, which is basically the hemorrhagic infarct that you see grossly. So this is the specimen of fibroid, the leiomyoma with red degeneration. So the next question will be asked, what are the conditions for the fibroid showing red degeneration? So red degeneration usually occurs in basically pregnant females, in which the fibroid overgrowth the blood supply, its own blood supply, and that area is showing the hemorrhagic infarction because of lack of blood supply. The next specimen is the same leiomyoma specimen, but the position is subserosal in this and intramural in this. So both type of fibroids are there in this specimen, and in this specimen also multiple fibroids are there, and this specimen single fibroid which is intramural in position. Now the question asked is about the microscopy. So you can see in this, you are able to appreciate the nodule is this is a low power image of the nodule which is well circumscribed, not infiltrating the myometrium, and the tumor is arranged basically in the form of fascicles. Fascicular growth pattern is there. The spoon muscles which are there in the form of fascicles are plumped in shape, which are not showing areas nuclear pleomorphism, no nuclear pleomorphism, no atypia, no necrosis, no hemorrhages, no mitosis is seen. So that's why it's a benign soft tissue tumor of the uterus, that is leiomyoma of uterus. Thank you.